Hello everyone. Heart attacks nowadays are the most common cause of deaths across the globe. It has far surpassed cancer and road traffic accidents. One of the ways of preventing ourselves from the catastrophe in acute heart attack is to identify its symptoms. And today I will be taking few questions which patients ask me most commonly about symptoms of heart attack. Hi, I am Dr. Ashish Gupta, a consultant intervention cardiologist at Max Hospitals, Gurugram and Crystal Clinics. The most common question that I encounter patients asking me is, "Sir, what are the symptoms of heart attack? What is the pain that should be worried about?" So, the most common symptom of heart attack is a diffuse chest pain. A chest pain which is present in the center of your chest, left side of your chest, or sometimes on the right, but which is diffuse. It will not be localized. The nature of the pain would be like you would feel that there is some heaviness in your chest, like some weight has been kept over it. You will feel congestion. You will feel a constriction like feeling, or you will feel suffocation, choking. If you are encountering such kind of pain in your chest, which is lasting for more than few minutes, you should be very careful about such pains. This pain can be a heart attack. The next question patients ask is, what are the other symptoms of heart attack in addition to the pain, or what are the other features of such heart attack pains? This pain is generally radiating. You have to be careful to understand what radiation of pain means. A pain which is happening in the chest and then going out to various other areas like your shoulders, your arms, your forearms, to your neck, to your jaw. If you have a chest pain which is radiating to these part of your body, be very cautious. More likely that this pain is related to heart and you are having a heart attack. The third question people ask me, is sweating associated with heart problems or a heart attack? Oh yes, but there is a difference. Mild sweat can happen to anyone. There are so many patients who have sweating while eating, who have a general tendency of having excessive sweating. That may not be a sign of heart attack. But when someone tells you that even in winters I was drenched in sweat, that symptom is very typical of a heart problem. If you have a chest pain and you are having excessive sweating, please be aware that this pain and this sweating is heart related. Of late, we have heard a lot of cases where people have suffered a heart attack and in fact died when they were having some gastritis-like symptoms. So, a very common question being asked nowadays is, how can we differentiate whether it is a simple gastritis or a heart attack? It's very important. A gastritis happening to you like never before, a gastritis in a patient who has never experienced gastritis-like symptoms is again a sign that something might be wrong. A feeling of burning in the central part of your chest, which is not getting relieved by taking antacids, which is associated with some breathing difficulty, associated with some sweating. More importantly, if you are having this gastritis-like symptoms like burning in the center part of your chest or belching, and it is happening only when you are walking or exerting, this pain can be related, or this symptom can very well be a heart-related problem and just not a simple gastritis. We are seeing a great rise of heart disease in females nowadays. This particularly is a subgroup which was neglected till late because we believe that females are protected from heart diseases. Females report to doctors late, they report about their symptoms late, and as physicians also, our threshold of evaluating females is higher than that of males. So in females, what is important that you may not have typical symptoms. They may not have a central or a left-sided chest pain. They may have atypical symptoms like new onset of excessive breathing problem, breathlessness, pain which is radiating to their jaws, to their back, which is not very typical as we find in males. So in females, we have to be extra careful. A very common feature in females is of nausea, a burning sensation in the central part of the chest, gastritis. So such female symptoms have to be taken very carefully, and you have to get them evaluated because they can be an indication of heart disease. Another question which people ask me is, can a subset of population have atypical presentation? Yes, diabetics, elderly people and females can have very atypical presentation of heart diseases. A simple fatigue, a simple gastritis, a simple episode of sweating, a simple episode of exertional breathlessness can be a sign of heart attack in diabetics and elderly population. We have heard so many times that diabetic patients can have silent heart attacks. So we have to be very careful in such. Lastly, so many people ask me, and among doctors we discuss many times, why do people delay in coming to doctors when they are having such symptoms? Most of the times they are not ready to believe that they are having a heart attack. They believe that this might be something else. Many times they are just afraid of raising a false alarm, and that delay proves out to be costly on many occasions. So my advice to all my patients is, do not die of doubt. If you have any doubt that this pain can be related to heart, immediately consult your doctor. That can be life-saving for you. Thank you so much.